You're watching Fox 10 Arizona Morning with Ron Hoon, Rick D'Amico, Andrea Robinson, Kristen Anderson, and Corey McCloskey in HD.
There he is. There's Corey.
Whoa, what's wrong with you?
What happened to you, buddy?
I know. Well, you know, I shouldn't have jogged down from Litchfield and Waddell to Litchfield and Camelback.
No, that's
I'm just kidding.
Far jog.
Where do you think I am? I mean, when you look around at a room like this, where do you imagine we are?
I'd like
Motel
to,
6.
I want to take a nap.
West Valley Resort. Yeah, I do too. We are actually at the Phoenix Neurology and Sleep Medicine Lab. You know, you've heard about people with sleep troubles. This is where they come, to a beautiful place like this. And Dr. Troy Anderson is with us. I'm totally wired up. You were able to wire me up ahead of time, but I assume that there must be many, many people who don't feel great. They wake up feeling so-so, but they don't even know why, right?
That's right. There's a lot of people that have daytime sleepiness, and there's a lot of reasons why they can have a good night's rest. Very important for your health. But one of the biggest things we see here today, the most common disease, is something called sleep apnea. And sleep apnea is when you stop breathing at night, and that can increase your risk for heart attack, stroke, and heart failure.
Now, would you say that if someone snores, is that like a warning sign? Or I mean, I assume that it's not good for your partner, for sure.
So snoring
could be a sign of something else.
Snoring can cause divorce, but besides that, when
divorce. I wasn't going that far, but go ahead.
I've seen it happen.
Really? Wow.
Yes, but if you combine snoring with other things, like if you're sleepy in the daytime, if somebody sees that you stop breathing, if you
not just from a pillow over your face, but
right. If you have problems with depression, high blood pressure, other things like that, could indicate that snoring is more than snoring, and you have sleep apnea that we talked about.
Well, I'm rigged up to see if I would have something like that. Here's some of the options. They're not the most attractive, but boy, they can really change your life, can't they?
Yes, they can. So what these things do, this is an air splint, and what it does is it pushes the airway open to open up the airway, and so that way air can be delivered to the oxygen, and to the lungs, and you can exchange oxygen.
Now that's not a cool clock radio, but that's a good-looking machine. That drives the whole operation, right?
That's right. This is the latest machine. They're getting, the technology is incredible. So this looks like a clock radio that you can put on the side, so it looks pretty. And before they had these old ones that look kind of.
Yeah, you don't want that. You want to represent.
Right, exactly. And you can get these neat skins where you have like the Cardinals or one of your favorite teams.
All right, well, let's head down the way here and we'll show folks where all the technology actually happens. Now, you must have a night shift working here because people sleep at night, right?
That's right. We have a night. Most of the work is done at night, but we do have day studies sometimes for patients that are night shift workers.
Oh gosh! So Rick here is setting up the room, one of the rooms across the way. So, and Janie's over here working. What is Janie doing, by the way? That seems like a lot of graphs there.
Yeah. So what we're looking at right here, Janie's looking at the brain waveforms as well as the heart rate, the oxygen level, if the legs are moving, how many times they stop breathing, and when they stop breathing, if that's associated with oxygen desaturation. So that's what she did.
Wow. So you'll take a whole picture of someone's sleep experience. And do you find that when people come to your lab, are they sleeping normally? I mean, is it once they kind of get used to the room and all, they're not like, it's not weird for them, huh?
No, actually, this is what we did in our sleep lab. I've been a director of many sleep labs, one for the Navy, but we made our sleep lab model after a San Francisco hotel, St. Francis.
Oh, yeah.
So that's why.
Isn't that where they shot the TV series Hotel?
They did.
I think they did.
But as you can see in our lab, because it looks so beautiful and our sleep efficiency rates are around 95%, typically labs get around 65 to 70%. So they sleep really well, and the drive for sleep is stronger than the drive to eat. And so people do sleep. They're not ready to go, but they will sleep.
Okay, and who's your most likely patient? We have about 30 seconds. Can you kind of wrap it up for us? Who is going to end up here?
The patients that are going to up here are the ones that are having problems with snoring, daytime sleepiness. Somebody says seeing that they stop breathing. They have developed difficulties with high blood pressure, diabetes, high cholesterol, and their health is kind of going downhill. They're tired all the time. They don't have energy.
And is this something that's going to be prescribed by their doctor? They'll send them on in here? Or?
That's right. So their physician will recognize this, but oftentimes physicians take care of them and they don't ask them these questions. And so if they're having problems with these things, they need to bring it up with their doctor.
Very good. All right. Well, Well, it's Dr. Troy Anderson with the Phoenix Neurology and Sleep. Well, this, I don't need that or that. One, that's too many. No, no, yes. I'm kind of a one pillow. Well, I want this, but I'm kind of a one pillow guy. Do people use all those I don't want this either. It looks pretty, but nah. When I get into a hotel and everything goes.
I do 2 pillows.
That's boring, Corey.
Oh, no, 3 at least.
I'm 4.
Ron's
Who
3.
wants 2 pillows?
I got
I
4.
need to read.
I do 2
Hit that
pillows.
light, would you, Doc? All right. Oh,
You're totally milking this segment just to get a nap in before the noon show.
I am not even coming back for the noon show. Tell Christy she's on.
No, no.
Look at that.
You know what? From a guy that went to bed last night at 4:30, you don't need a nap yet.
Yeah.
He went to bed at 4:30 yesterday
You gotta be
afternoon.
kidding me.
Swear.
Wouldn't it be interesting if we could check back in like halfway through Wendy's show and see what he's dreaming about?
Oh, like the bubbles coming out of his
Well,
head?
sort of, yeah.
I don't know if anything would be coming out. Maybe just like nothing. Didn't you say once when we're just sitting there, we're
Nothing.
not thinking about anything?
It's
Nothing.
It's like right now they're saying, oh, you just guys keep talking to the end of the show, and I'm going,
That. Is this really Corey?
There's nothing going on.
Or are we just...
Oh.
Yeah. So Corey's going to sleep us out.
He's